Okay, so this injury is going to be our incision. So we have done an abrasion, which is a scraping of some of the superficial epithelial cells, and we've done a laceration, which is a combination of an incision and an abraded area. So this is like a surgical incision where you've had a nice cut. It's nice and deep, and it's long enough that we think it may require some sutures. So we're gonna clean this up first, and we can kind of open the skin up and look in it and see how deep it is, and then we're going to apply an adhesive steri strip, try to hold the skin together, and then put a secondary dressing on it and send them to the doctor for some sutures. Like I said yesterday, some facilities have Dermabond, which is a sterile super glue, and if it looks like we can use that Dermabond, we can just super glue the skin together. This can be a tricky wound to take care of because a lot of people want to pinch the skin together, but remember, we don't want to apply any tension. We just want to bring those edges close together. Because when we start to apply tension, we're going to increase the scar on the person. So again, just like before, we're going to pick our PSI of 7 to 15. We're going to irrigate the wound. Okay, this one's a little bit different. It's not abraded tissue, it's just a real cut through there. So we want to make sure we get it nice and clean. We can get all of that fresh blood off. And then when we do this one, we sort of can pat over the area and get to that adhesed area. And of course, this is not injury right here, so we can give a push away sort of scrub to that area. And I also brought out this sterile saline wipe. So once you get it clean, it's sort of like a hand sanitizing wipe. And we can use that on the peri-wound area as well to really try to clean that area off before we apply those steri strips or closure strips. So I'm not really touching the wound itself, I'm just cleansing around the wound. Okay, I'm gonna go ahead and change my gloves one time, and I'm going to try to dry down this area so that we can apply those closure strips. Pause it for a second. So now we just need to pat the area down on and around the wound. We really want to try to dry that area because we're going to be applying sticky sort of closure things. I don't have the Telfa or the Tough Skin with me today, but normally I would take a Q-tip and I would spray some Telfa, and I just kind of place the Telfa on all sides of this injury, and it just makes the area nice and sticky so that the closure strips have an easier time of fastening to the skin. So once you get it nice and dry, then you want to apply your, these are called leuco strips, they can be called steri strips, it just depends on the company that's making them. So they're nice and sterile. We're just gonna open them up here. Like I showed you in class, 2 come in 1 pack, so we're gonna leave it in here. You can rip off the edge of one, that way you have the exposed steri strip right there. These are super long steri strips and super thick ones, so they come in different sizes. So what I'm gonna do is take these and just kind of clip them in half here. And then what you wanna do is pull your first one off, and I'm gonna have you hold the bottom of that for me. Then we just want to pinch the skin together, and because this isn't a real cut, the skin is obviously not gonna come together, but you would just bring that skin back together until it touches, and we're going to just see if we can get good tension on it. Then we're gonna place this edge of this steri strip down. We're gonna apply the pinch right here. We're not gonna pull this steri strip. We're just gonna lay it down over the top once we've pinched the skin together. And then we wanna go to the other edge, and we want to apply this nice and light right here as well. Then we just wanna take that skin and close it and lay that steri strip down. Remember, we're not doing any tension or any pulling. If the skin is still separated there, we can go ahead and use this last steri strip right here to apply one more. Okay, sometimes these closure strips are good to use without ever putting any sutures in, but sometimes, especially if we had a suture that was needed like on the face, we would want to send them to a physician. Then we can use either our Telfa. This time I'm going to use the hydrofilm. Okay, I just want to show a different type of material. So for this one, remember we just peel back the edges here. So we're going to place this on. Okay, we're going to place this on first over the top, just like this. And then we can pull it off. And the neat thing about this is we can see underneath it, it's called an occluded secondary dressing. So it's closed off all the way around, but we can still see those steri strips and we can see the skin underneath it if we're looking for infection. Okay,